concussion takes 1 to 3 weeks to heal, with pulled hamstring 4 to 6, and bruised ribs 3 to 6 weeks to heal, and torn ACL up to 6 months. All these sports-related injuries, but obviously ACL tear takes the longest, most strenuous to heal. ACL tears happens when one foot is firmly planted, hit with force, or the knee is slightly bent when pivoting. According to John Kluwer on orthopedic experts, 80% of ACL tears are non-contact. The reason ACL tear is such a major injury is because the ligament controls 90% of stability and cannot heal itself. With youth athletics on the rise, there was around 200,000 ACL tear cases annually, according to Dr. Danino, a writer of WebMD. The most relied upon and trusted way to heal an ACL tear is to have surgery. But before that happens right after the tear, you have to wait for the swelling to go down and regain full ROM, range of motion, and then rehab for 1 to 3 weeks to get 70% of strength back and to assess what creates the pain and where to fix the problem. That has to happen because the amount of flexibility you have going into surgery is also the amount you have going out, and it can also shave weeks off post-operative rehab as well. During the surgery process, the surgeon and the athlete must come together and decide which area to graft from. There are 3 areas: the patella tendon, the quadricep, and the hamstring. They're all possible areas. Post-operative rehab is lengthy and takes months for athletes. The first 1 to 3 weeks is getting back to normal range of motion. The next 3 to 6 weeks gets back to strengthening and being able to use the knee normally. Weeks 7 to 12 go through light jogging and pool activities, but no strenuous activities like basketball, soccer, or football. Post-operative rehab has a 90% success rate, and re-rupture rate is as low as 2.6% on the average of 2.5 years. A different route to go has also been considered, not just physical therapy and avoiding surgery as a whole. One study done by Dr. Frobel and his team on 121 young active adults, they all had ACL tears. They were split into 2 groups. One group underwent surgery, and the other just did physical therapy. After being watched closely, and after 1 year, they came back, and the results were the exact same. Neither group was better, neither group was worse, but it proved that surgery doesn't have to happen every single time. You can avoid a costly, strenuous, and invasive process that puts even more stress on you and people around you. But since ACL tears are a growing concern, one company has come up with a completely new way called eugenics. It's the process of taking bone marrow and processing, changing its chemical makeup, and then inject it back into the knee where the ACL tear happened. Bone marrow helps replace the ligament, but clinical trials are just starting. It's a great idea in theory, but hasn't proven yet. Another new breakthrough is using experimental collagen and a platelet-rich gel. A team headed by Martha Mayer in 2006 experimenting on animals. The results show great feeling from 3 to 6 weeks and strength from 40 in the test group to 14 in the control group, but has problems in humans. The liquid can seep through the joint and cause problems. Thickening the gel only did not help the solution at all. So again, a technique that's great in theory, but the work in progress has many possibilities. But there are things you can do to avoid all this in the first place. A combination of strength training along with jumping and balance drills can help. There are also ACL and conditioning programs made for people, especially soccer players. They're geared towards female soccer players because female soccer players are 8 times more likely to tear their ACL than male soccer players are. With ACL tears on the rise, and so are youth athletics, there are new ways innovations being made every year. People are recognizing this is a concern, and the injury is no longer a career-ending or life-changing event.